Content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor. I am your host, Louise Gomez. We are sponsored by All County Healthcare. We're a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. Tonight we have the pleasure of introducing everybody to Dr. Alexander Gaukhman, who's right here at Baptist Health Orthopedic Institute. And the address is 745 Meadows Rd Suite 100, Boca Raton, Florida 33486. Phone number is 561-955-7100. Also located another office in Deerfield Beach at 3313 West Hillsboro Boulevard, Suite 202 in Deerfield Beach. You can also check out the website, baptisthealth.net. And Dr. Gaukhman specializes in hip and knee replacement, board certified as an orthopedic surgeon. Thank you so much for coming to the show, Dr. Gaukhman. I appreciate it.
Thanks, Lisa. It's happy to be here.
Yeah, we appreciate you taking time out of your busy schedule. We know how busy doctors are, and you have hectic schedules. So
of course, it's been a pleasure. It's been 4 years since I've been on the show, and so a lot has changed.
Nice.
And so I'm happy to be here and kind of discuss some of the things that have changed in Palm Beach County.
Yeah, absolutely. Let's delve a little into your background.
Sure.
What inspired you to become a doctor? Where did you go to school? A little bit about your past history.
Yeah, I'm originally from North Florida. I came here actually from Russia in 1992. We were immigrants, my family and I. I grew up there, ended up following the medical track. Actually 3 out of my 4 grandparents were all physicians.
Oh, runs in the family.
Runs in the family, exactly. One of them was a surgeon, 2 were pediatricians. So I always had a little bit of exposure to that growing up. My sister wanted to go into the medical field. I just ended up following her and ended up going to Florida State for medical school and kind of just fell into orthopedic surgery. It's a phenomenal field, and it's something I'm very passionate about. It's not only something that it's my career, but it's also something that I'm really truly love to do.
Yeah. And so what I was going to ask, what type of demographic are you? I know you're doing replacements. Is it mainly seniors, or who would need a hip or knee replacement?
Yeah, it's a great question. So nowadays, hip and knee replacements are becoming very common. Almost everybody knows somebody that had a recent hip or a knee replacement. The typical demographic is somewhere between 50 and 60-year-olds. However, nowadays patients are more active and they're leading more active lifestyles, and they want more out of their hips and knees, and so they're less tolerant of pain. And so we do have 40-year-olds, 50-year-olds who are getting hip and knee replacements, and they do very well afterwards. They end up increasing their functional activity. They can go back to things they like to do, like skiing, playing basketball, golf, tennis, pretty much anything you name. Most patients are able to go back to it to some level of participation. It may not be the same level that they were doing when they were, in their teens or their early 20s, but they're still very active afterwards.
And so how would somebody know that maybe they would be a candidate? Is it an extreme pain? Is it just not being able to be flexible? So people are listening right now. What are some indicators for them to notice that would be something that's going to affect their hip or their knee?
Right, that's a great question. Now, usually it's an insidious onset, so there's no acute event that happens that triggers them to feel like something went wrong. Usually it's slow, and it becomes a little bit more chronic in nature. Typically there's no swelling. It's usually just a discomfort that's exacerbated with some sort of types of activity. Sometimes it's just walking. Other times when patients are very high functioning, they notice they can't play tennis as well. They can't move. They have pain. The swelling really comes when they start getting a little bit more degenerative symptoms in their knee, and then they start seeing those kind of things.
I see.
But usually the mainstay of treatment is usually non-operative. When they get an evaluation with an orthopedic surgeon, they can kind of tailor their treatment plan based on the severity of their symptoms or maybe how progressive their disease has become.
And so, what is the recovery time once they do the surgery? I know everyone is probably different, but what's an average of a recovery time?
Typically, recovery time varies based on the patient's pre-surgery function. If they're very high functioning, they're walking around with any assistive devices, they're driving, they're working, they're typically going to do a little bit better than your sedentary 65-year-old to 70-year-old who's more of a couch potato.
Right, of course.
But typically, most patients go home nowadays after surgery. So the surgery lasts anywhere between 45 minutes to about 90 minutes.
Wow.
A lot of the things that's being
impressive.
done. It is.
What?
It's definitely
45 minutes?
Yeah, it's definitely changed over the last 20 years. 30, 20 years ago, patients were in the hospital for maybe 7 to 9 days. They were going to rehabs.
Yes.
Nowadays, the same patient can have the surgery done in an outpatient center where the surgery center and the surroundings are tailored to those type of patients. They're around nurses and doctors who are less likely to be exposed to different types of diseases, and so they have the opportunity to go home the same day and start physical therapy, in a very short
Right.
period of time.
So, a quick question: what has changed? Has the technology changed, where the surgery now is shorter in length? Is it the technology that you use, or what has evolved over like a surgery from, let's say, 30, 40 years ago to now?
Right, that's a great question. The majority of it has to do with the techniques of how we do the surgery. From an anesthetic perspective, we tend to use less general anesthetic now. We do more local or regional anesthesia. The incisions are a little bit smaller. There's less blood loss. There's really been an advent of technology in terms of the medications that we use to prevent blood loss. So patients can recover a little bit faster. There's a little bit less swelling. A lot of the implants that we use haven't necessarily changed over the last 20 years, but it's just the way that we put them in. There's less
Right.
trauma to the actual soft tissue surrounding that and allows them a little bit of a faster recovery.
And what material is the piece made out of, the replacement?
There's usually different types of materials. The majority are metal. They have some sort of plastic in between, and sometimes we use in the hip, I should say, we should use ceramic materials as well. So there's a kind of a litany of different materials, but the majority of it is metal, plastic, and some sort of ceramic.
So, a lot of people listening, they're wanting to know prevention. So, any ways to keep our bones healthy as we age? What do you suggest to do, like, early on?
Right. I think early on, prevention is definitely key. You want to stay active. You want to try to stay as thin as possible. But fortunately, at the end of the day, genetics tends to overpower all the things that we try to do. Some patients are more predisposed to having cartilage wear or developing arthritis in their joints. So it's not something that we have necessarily conscious control of.
Right.
But obviously, having a healthy diet and staying thin and active can improve your outcome or really decrease the functional deterioration that we have with time.
And, I hear people in my 50s, so like people my age, they're saying, you got to do the weights because weights help the bones. Is that something?
Yeah, absolutely. Weight-bearing exercises are a little bit
exercises.
better when it comes to bone health or decreasing the risk of developing osteoporosis. So basically, when the bone becomes thinner, the bone mineral density tends to decrease over time as we age. And so when we stress them, such as with some sort of weight-bearing activity, that decreases the risk of us, all getting bone mineral density or osteoporosis.
I mean, that's the motivating factor, right? To do it for our health. So definitely, for me, it is the motivating factor for sure. So, you mentioned briefly about diet. So how does a healthy diet impact bone and joint health? Like any foods we should avoid or any type of, hacks or tips or tricks you
Right.
can give us?
Yeah, and that's a tough question because diet is really everything, but it's such a hard
Yeah.
part to really control. And I can't really speak to that because my diet is not really that great either. But I
Okay.
think staying away from a lot of the processed foods that are
absolutely.
really loaded with calories and loaded with oils and things that are not good for us is probably key because in very small portions they can be okay, but in larger portions, and we all tend to overindulge a little bit,
Yeah.
it can really add up very fast, and that could
So
decrease
true.
our ability to take in foods that have more vitamins and minerals that are more healthier for you. So I think kind of staying away from the process is really what I try to really
Yeah.
abide by personally. But again, it's tough
Sure.
because they're so readily available.
I know. It's just making that conscious effort to say I'm going to eat whole foods, right? Not these boxed foods. So what do you suggest as exercises? Maybe you have a patient coming in and they're not quite eligible for the surgery. What advice would you give that person?
I think getting hooked up with somebody who is a professional or an expert in that field, I think is really important. If somebody is sedentary and doesn't quite know which route to take, I think the best mode would be to find a therapist or a physical therapist that can help guide them in the right direction because they're the ones that really see them on a regular basis and they can tailor their treatment plan to how they're doing. So somebody, not one treatment plan works best for everybody, but
Sure.
to have physical therapist who's there with them for a majority of time, they can really do a great job at figuring out which step, which direction to really put them in. If they don't have access to a physical therapist, starting a low impact exercise program works best. And a lot of that low impact is from walking, from maybe walking on a treadmill on an incline is really does a lot for you. And that can
Yeah.
really burn a lot of calories and
Yeah.
it can help patients who have some moderate knee and hip pain. A lot of low impact exercise also like swimming or riding a bike is even better because there's a lot less of a gravity pull from that too, and
Makes
that
sense.
tends to decrease the amount of pain or the force that the joint is seeing.
Makes sense. So let's talk about people who have an accident. Maybe they fall down. I'm sure you see plenty of people that have that situation. I hear very frequently that people maybe fall and they have an accident and something happens. Things can change quickly, right? And speak into that.
Unfortunately, we see that quite a bit, especially in the aging population. Small, low, what we call low mechanism falls, where you just fall from standing or fall from a chair, can really
Really?
increase the risk of somebody getting a fracture, especially when they have osteoporosis and their bone is a little bit weaker or brittle, and something that wouldn't really affect you and I, we would just get a bit of a
Sure.
bruise would actually cause them to have a fracture of their hip or their knee, and that's very, very common. And all the underlying factors really is osteoporosis. A lot of those patients, when they fall, they can't get up. They end up having a fracture in their hip, and it, depending on the type of fracture they have, really dictates their care. But a lot of them end up getting hip replacements. Fortunately, like we talked about earlier, we've had a lot of advancements and revolutionary kind of in the field of arthroplasty or joint replacement. So a lot of those patients who do fall and need a hip replacement or do need surgery are up and walking within a few days of the surgery.
So, explain to me again osteoporosis. I know we hear it a lot. What exactly does osteoporosis mean?
Yeah, osteoporosis essentially, if you think about it, brick or a cinder block, it's just basically when that brick starts to become brittle and it gets hollowed out, or maybe necessarily, like a coral sponge where it just becomes brittle and brittle. There's more holes in it, and so instead of having enough structure in it, it just breaks down, and so it's a lot easier to put your finger right through that coral
Yeah.
when there's more holes in it versus
Sure.
when it's nice and thick and robust. And really all that is osteoporosis. And so
Is that a lack of minerals?
it's a degradation of the actual bone mineral.
Degradation
Right,
of
yeah.
the bone
So instead of
mineral.
having a nice robust surface where it's nice and hard, it basically starts to decrease and it just becomes more brittle in nature.
Anything we can do to remineralize our bones or
Yeah, and unfortunately, as we get older, it always just continues to progress. So the
Yeah.
most that we can really do is to maybe stop that progression or prevent how fast it becomes. There's certain medications that can help with more advanced cases of osteoporosis.
Yeah.
Oral
We have a quick
medication.
commercial break. I'm sorry to cut you
Not a
off.
problem.
We'll be right back. Be right back, everybody. Stay tuned.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we are back with Dr. Alexandra Gaukhman right here at Baptist Health Orthopedic Institute. And the address is 745 Meadows Rd Suite 100, Boca Raton, Florida 33486. And the phone number is 561-955-7100. And it is baptisthealth.net, and you can find out more information there. So I'm enjoying this conversation, Dr. Gaukhman. I'm learning a lot. I think we were ending the conversation with you mentioning that people can go see their primary care physician if they need maybe medication for osteoporosis.
Yeah, typically you have to get evaluated by some sort of professional, either a primary care physician or
Sure.
rheumatologist or maybe endocrinologist. But the first step is really making that diagnosis, and the way we typically do that is with a bone scan. Essentially,
yeah.
it looks at how much bone mineral that you have at various sites in your body, like your spine or your hips, and you get a score.
Okay.
Based on that score, that dictates whether or not you need maybe some conservative management, like increasing your weight-bearing activity, or if it's really advanced and severe and you're at a higher risk for a fracture at that point, they would make that decision and place you on some sort of medication. There's various medications out there now. You probably have seen them on the TV advertised.
Sure.
And so a lot of them you can actually just get once or twice a year, and really that is helpful versus taking a pill on a weekly or daily basis.
Good to know. Yeah. Are you seeing an uptick in those who are needing joints replaced as we see seniors who are active? Because I know there's a lot of active seniors in the community, golfing and pickleball and tennis. Are you seeing maybe an increased number of people because there's seniors are active here in South Florida?
Yeah, absolutely. And our environment here, obviously, the baby boomers, they're here, and there's a lot of them, and they want to enjoy their golden years. And so a lot of them want to stay active. And as we were talking previously, they're less tolerant of having pain. And again, it's becoming such a commonplace surgery. Hip and a knee replacement are becoming one of the most common surgeries that is performed in the United States and all over the world. And a lot of that's been to the advance of technology and the way we're doing it and how fast the patients are recovering. Everybody knows somebody that had a hip or knee, and And when they see how well they're doing, it gives them a little bit more positive encouragement to go seek out an evaluation for themselves and maybe seriously think about having a knee or a hip surgery. I think historically there's been a little bit of a stigma to getting surgery, but once they have an evaluation with somebody who does them on a regular basis, I think their anxiety is a little bit just put to ease when they see that this is more or less still a major surgery, but it's so
Sure.
common that people are having good outcomes, and they themselves can, be in that good outcome
Sure.
population.
Absolutely. And can you tell us about the Cooperman Medical Arts Pavilion and how are they expanded the Baptist Health Orthopedic footprint in our area?
Absolutely. So the Cooperman Medical Arts Pavilion has really been revolutionary to how we do things. And so we have moved from the hospital to the outpatient center. And so we see patients there. We're able to evaluate them. We're able to make their diagnosis. We have x-rays there. So everything is in one place. We're all under one roof. So all the subspecialties of hip and knee, or shoulder, elbow, hand.
Yeah.
We're all there at one point in time, and we can take care of the patient in a more holistic manner and see them versus
Yeah.
sending them out or kind of decreasing the amount of time they spend in the community. Furthermore, we also have the ability to do surgery there, and a lot of our hips and knees replacements, our sports surgeries, arthroscopies are all being done on an outpatient center. And so it's
It
really
makes
been
sense, yeah, to have it all in one local place, right? Makes
Absolutely,
sense.
yeah.
It's easier for the doctors and it's easier, I guess, for the patients as
It's
well.
easier for the patient, it's easier for the doctors, for the staff. Everyone pretty much has the same goal in mind, and they're all taking care of the same type of patient. Somebody who's there for an elective procedure, not necessarily somebody who's there for some life-altering, procedure. If they have cancer, or if they have heart disease, or they have some sort of colon problem, they're all separated from that,
Right.
and they're all really focusing on just the kind of the orthopedic side of it at one point.
I'm curious, what do you think the future with all this technology and the evolution of surgeries, what do you think maybe 50, 60 years from now? What do you think about the technology and how it can help in the orthopedic world?
Yeah, it's very exciting. I think in 50, 60 years, we'll still be doing hip and knee surgery.
I'm sure, maybe more.
I still think
Of
we're probably
course.
doing replacements. I think it's going to become more commonplace. I think
Yes.
it's even more so than it is now. I think even more younger patients are going to be getting it. It's exciting to think about some sort of genetic technology that can potentially alter the path of a disease. That we're a little bit far away from that, but it is getting to a point where we can kind of alter some of those genes a little bit through different pathways. Again, it's a little bit more experimental.
Sure.
But hopefully we become even more efficient at doing surgeries, decrease the risk of having complications. Just because it's really common and most patients, 95% of patients are doing well, there's still always room for improvement, especially in the total knee side, to give patients even a better outcome, to make it feel more like a natural joint, less of an
Sure.
artificial joint. And really what we try to do is just push down those complications even further. And although they're very low now, we want to really just keep pressing it down and making it lower and lower to the point where it's a very low risk surgery.
Sure. Well, Dr. Gaukhman, we actually have 2 minutes left. Any maybe last takeaways or any feel good stories of any patients you might have had? You have 2 minutes to just share.
Sure.
on
Well,
whatever's
again,
going on.
I appreciate you letting us come on and talk about
course.
this. Like I said, it's very exciting. Something I'm very passionate about. So I think the biggest takeaway is if there's any pain or discomfort, or there's any anxiety or anything that keeps you up at night, I think having an expert opinion can always help and quench some of those problems that people
Sure.
have when they go to bed, essentially. But
Yeah.
that would basically be my takeaway.
Yeah. And, well, we want to thank you for coming on, and I'm sure we'll hopefully see you again soon and maybe share with us other exciting things going on where you're at. So I will repeat your information again. Anybody can reach him at 561-955-7100 right here at 745 Meadows Road, Suite 100, Boca Raton, Florida, 33486. And we will see you next week. Thank you.
Thanks.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having